Okay. I think we're good. Hello, 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 everybody. Happy Sunday. You know what it means. If it's Sunday, it is the Sunday shift where we come together and we talk about all things nursing, what's going on in healthcare, what's going on with ATITs, what's going on with nursing school, all of that stuff. This is our time to get together, sit down, and just have a little chit chat about what's going on around us. This is really a live that we do every Sunday for you all because I know the anxieties, the pressure, the concerns that come with getting into healthcare and making sure that healthcare is the right decision for you. So that is the reason that we do this every single Sunday so that we can really just have a chance to kind of vent, express our concerns in a safe place for everybody and everyone. So this is your time. If you have any questions, if it's something's been going on, you're concerned about, now would be the time for us to talk to each other and get a lot of our questions answered and hopefully make healthcare a little less anxious, a little less anxiety. Hello, hello, Ellis. Hi, Rita. Hi, Dana. Hi, Sue. Hi, Yesenia. Hey, Gabriel. Hi, Asha. Hi, Nunya. If I fail the math portion, can I still pass the T's? My school just needs an overall score of 58.7. So here's the deal. If you were unsuccessful in the math section and you were going to a school that doesn't look at your grades singularity, meaning that they don't require you to have a specific grade for reading, math, science, or English, but you still get the comprehensive score that you need, you should be okay. But my recommendation to you is to talk to the school. Just make sure that they're not looking at individual scores. As long as they're not looking at individual scores, you should be fine. I personally didn't do well on reading when I took my T's, honestly, both times, if we're being fully transparent. But I still passed because they weren't looking individually, they were looking cumulatively. So you're good. But just confirm. What is your advice on working during a BSN program? That's a great question. So, personally, I worked for a portion of my I didn't do a traditional BSN program. I did a concurrent program, meaning that I took my associate classes and my BSN classes at the exact same time. During my second and third semester when I was in nursing school, I worked night shift full time on a oncology PCU as a patient care technician. Now, here's what I will say. There are people that are able to work full time and absolutely make the best of this and still meet the objectives and things that they needed for their nursing school requirements. I was not one of them. So basically, because I was working full time, I would do a 12-hour shift at night from 7 p.m. to 7 a.m. I would have class at 8:30 in the morning, and my classes would be from 8:30 to they could go till 12. They could go to all the way until 4:30, depending on if I had simulations, skills checkoffs, things like that, because I was doing my bachelor's at the same time as my associates. And then I would go home, get a couple hours of sleep, and then would have to go back to work. So I don't recommend that. I feel that if you want to work while you are in nursing school, because of the variation and changes when it comes to your schedule and when exams are and when simulations are going to be, my biggest recommendation is to look for a per diem job. That way you have full control over your schedule, because there's going to be weeks you can't work full time. There's going to be weeks you can't work part time. There's going to be weeks you can barely work per diem. But if at least you have a per diem position, you can say, yes, I can work this. No, I can't work this. And you have control over your schedule. So it is feasible to work while you are in nursing school. You just have to make it work for you. I'm about to take the T's and I'm stressing. No, you've got this. Everybody stresses about the T's. It's going to be okay. Trust me. Trust me. Hello. How do I find time to study for the T's whenever I have so many finals and have to also worry about transferring to nursing school? Here's what I'll say, Mika, is that when it comes to anything in life, really, you have to kind of look at it in one of two ways. The first way you have to look at it is you need to find your why. If your why is strong enough to continue to push you forward, you will find a way, right? So it could be that you're trying to prove to other people that you can do it. It could be that you are trying to make a better life from your family. It could be that you're just trying to do this for the money. Let's be fully transparent. We're not working for free, right? So it could be that. So if you find that why that's going to really push you forward, that will push you and motivate you to get it done. Not having time during the day, like I don't know your family situation. You could have kids, you could have a partner, whatever it looks like, but find that why will push you forward. And worst case scenario, if it is a time commitment issue, look for other resources that can help you. Maybe, if you have kids in a situation, you drop them off at their grandparents for a little bit. Maybe, your partner can take them or whatever it looks like for you. Also finding that time management piece too. The second thing that I always tell you, which really stuck with me when I heard it, was you need to find your hard, right? So right now, with everything being hard, can you push through it and continue to move forward? Or are you going to be like, this is too hard. I don't want to do it. And then you go someplace else for a period of time and then you never finish this and you never get the career that you want. So you have to find your hard. What's your hard? Are you going to deal with the hard right now? Or are you going to deal with the hard later? Right? When a lot of time has passed and you could have done this and been uncomfortable in a moment to ultimately seek comfortability. That's my biggest thing. Find your hard, find your why. I want to be a nurse, but I'm so scared of making a mistake. Have you ever made a mistake? I'm just someone who is getting yelled at when I do something wrong accidentally. Here's the deal. We've all made mistakes. If there is one nurse or person out there that has said, I have never made a mistake at some point in my life, they're absolutely 100% lying. We've all made mistakes. We probably don't want to admit to it, but we've made mistakes. Everybody and anybody's made mistakes. Whether it's you forgot to do something, or maybe potentially you gave the wrong dosage of a medication, or you slept past an alarm. Like, we've all made a mistake in some way. When it comes to healthcare, mistakes can be scary because ultimately we're dealing with patients' lives. But as long as you slow down and actually reassess the moment, yes, healthcare is going to be hectic. You're going to have 101 things going on at the exact same time, but you have to slow down and say, all right, let me regroup. Let me see what I've got going on. Let me see what I've got left. And then let me see how I can break this down to get caught up. That's the biggest thing. I think what happens in healthcare with us a lot is that we're just like, go, 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 go. And we don't actually sit down to evaluate what we've got going on. So that piece will be my biggest thing I can tell you. And here's the deal. If somebody's yelling at you, it's not a problem with you, it's a problem with them. Because at the end of the day, you can have constructive criticism and feedback without having to yell at somebody. I don't think that yelling is necessary. I do feel like if somebody is having a really difficult time and you're having to repeat the same things over and over again, then you might have to have a difficult conversation, but it shouldn't require yelling. It should never require yelling. We don't do yelling in healthcare when it comes to me. Like, we're going to have a conversation and we're going to be adults and we're going to go through what the problems are, but we're not going to yell. When are we going live teas again? Tomorrow. So Monday, Tuesday, Thursday. So I was in an accelerated program. So I wasn't in an accelerated program. So my program worked a little bit differently than what you typically see with accelerated programs. So my program, I had never had healthcare experience, right? So I had healthcare experience, but it wasn't in the way that I needed to have it in order to be in an accelerated program. So with me, I did my associates and my bachelor's at the exact same time, meaning that I took all of my associate classes and all of my bachelor's classes at the exact same time, not in an accelerated type of deal. Like, I would take 3 to 4 to 5 classes a semester while I was in nursing school, because that's what I needed in order to complete everything within 2.5 years. So Wasn't necessarily an accelerated program per se in the realm of what an accelerated program looks like, but it was a fast-paced program because of the way that it was. Mistakes is my middle name. I love it. We've all made mistakes. Like it's part of the human experience, right? Like if you've never made a mistake, you're doing really good in life, but I can almost guarantee you've made a mistake in some way. Some way. For example, I made a mistake. I went to a store and bought a non-drilled in shower rod. We bought 2 so far, and both of them were horrible material. They suck, and now we have to return it. That was a big mistake on my part. Shouldn't have made that mistake. I questioned it when I looked at it too in the store. When in doubt, get a supervisor. Yeah, and that's the thing. Like, if you have a good healthcare team, there are really, really good healthcare teams that are out there. If you have a really good healthcare team on your side, they're not going to yell at you. They're going to have conversations with you because obviously we need to make sure that you're safe and that you're going to do things based on protocols and policies and things like that. But there should never be a point in time when somebody's yelling at you. I think that's the thing that kind of irks me a little bit. And I've seen doctors yell at nurses. I've been in a situation where I've been yelled at by a lot of doctors. I mean, they get frustrated with certain things. It might not have necessarily been you. It could have been the person before you, but because of that, they yell at you. So you just have to kind of like set boundaries and be like, all right, let's be an adult and have a conversation. Would you recommend taking the teas online in person or just in person or online? So this is what I will say to you regarding the teas. It depends on your school. And the reason why I say this is because we had somebody who went out and took the teas at a testing center. They didn't take it at home, but they took it at a testing center. They've got an incredible score. It was in the 90s. Incredible score. Went to the school, applied for their program, and they were immediately denied because the school requires that you have to take it on campus. So my first recommendation to you is that you reach out to your school and ask, where am I allowed to take the test? So if they tell you, oh, it's campus only, or oh, you can only go to a PSI center, that in and of itself tells you where you can take it and where you can't. If they're the type of college that they're like, I don't really care, you just need to take it and make sure you pass, then my biggest recommendation to you is to find if you're able to take it at home or if you need to take it in person, meaning if you plan on taking it home, do you have a good internet connection? Because if you have a bad internet connection, if you lose connection with your internet, you're not getting that time back. So you need to make sure you have good internet connection. You're not going to have any distractions. If you have children, dogs, a clingy partner, whatever it looks like for you, that will also potentially look to the proctor as if you're cheating or that something's going on and they may turn off your test. So if you're going to have bad internet and you're going to have maybe a distraction situation, then my biggest recommendation to you is to take it in person at a PSI center or on campus. But always confirm with your campus where you can take it first so that you're not in the situation like that other student was where they had to retake it again on campus and apply for the next application period. I'm finishing my associates in science. I'm transferring my credits to another school. Do you think that counts if I want to apply as a nursing assistant? So, this is what I will tell you. If you haven't started nursing school yet, if you haven't started it yet, then you can't technically be a nursing assistant. You can't actually work in that role until you finish your first semester in nursing school. If when you say associates in science, if you mean you've already done your initial stuff in associates in science of nursing, then yes, you absolutely can, as long as you've completed that first semester. But yeah, complete that first semester. A lot of hospitals recognize that as you being trained to become a patient care technician nursing assistant. I'm aiming for LPN program at my school. I know LPNs have a limited scope of practice, so what can they do? That's a great question, Karen. It depends on the state, though. Depends on the state. So I will tell you that LPNs actually do a lot. I know that there's kind of like this confusion in regards to LPNs that they have a limited role. They do have limitations in certain things, but at the end of the day, they still are able to do a lot. I can specifically state Florida practice, scope of practice, is that LPNs can't do initial assessments. So, like the initial assessment on the patient to make sure that they're okay, but they can do reassessments on patients. They also can't do like initial assessments on blood, like blood products, something like that. That has to be done by a registered nurse. But they can do the reassessments. When it comes to medication, they can't push medication. So, like IV push medications, that technically can't be done by LPNs in the state of Florida, but they can give like oral medication, things like that. So, you do have a big, wide range of things that you can do as an LPN. There's just some limitation because of the scope of practice and the things that they teach LPN versus RN specifically. So, but you do have a pretty considerable amount of things that you do as an LPN. I'm deciding between nursing program and an OTA program. Based on your experience, what would you recommend? Do you think there's a bridge from OTA to nursing? I'm assuming that you're talking about occupational therapy when you say OTA. Is there a bridge? Not that I'm aware of. I'm not 100% sure, so I don't want to say yes or no. I don't know. Um, is there anything wrong with being an occupational therapist? Absolutely not. A lot of people don't necessarily want to work in hospitals. A lot of people maybe want to work in rehabs, or they want to they want to work with like sports rehabs where they work kind of like with physical therapists, and like speech therapists and like things like that. Like maybe that's your jam, and that's okay. Listen, not everybody wants to be in the hospital setting. So if that's something that you're wanting to do, go the OTA route. If you're interested in doing nursing, to have the ability to really transcend really a lot of career options in nursing, whether you want to do advanced practice nursing, you want to do bedside nursing, home health, hospice, uh, rehab, skilled nursing facilities, ALFs, concierge nursing, travel nursing. There's just so many things that you can do with a nursing degree. I'm always going to say pick nursing, but again, I recognize that not everybody wants to be a nurse, and that's completely okay.
So follow up question:
Uh,
Can LPN learn the same thing as RN in terms of when they are in nursing school?
So LPNs will learn some of the same things that RNs do. I mean, you still need to know your anatomy and physiology. You still are going to learn like basic patient care and different disease processes and things like that. It's just that school kind of like cuts off between RN and LPN is when they start looking at scope of practice, like certain things you can and can't do. So like for example, IVs aren't highly touched on because typically you don't really interact with those much. But again, that's based on your state. So every state has a different view on what the LPN role is, based on their state and what their standards are for that particular profession. So even in Florida, with the fact that they don't see a whole lot of like IV types of medications and things like that, you may see it in another state because you can maybe interact with it depending on where you're at. So, yes, we do have a lot of the same things that what are you doing? Oh, I thought you were snapping at something. We do have a lot of the same things. Sorry. We do have a lot of the same things that we are tested on together and that we learn together, which is why when you do LPN and eventually go back to be a RN, because that's what a lot of you will end up doing probably at some point in your life. Not everybody, but there is a pretty consistent amount that will do that. You will be able to do the accelerated programs and things like that because you've already been taught this a majority of the stuff that you needed to know when it comes to LPN. The biggest difference, I think, is like the initial assessment piece. is they're really big, like with RN and LPN, LPN specifically not doing initial assessments. That in and of itself is like a huge piece that you miss in the LPN program, specifically in Florida. So, and just to clarify, because there was a conversation that we had last week, and I'm just going to bring it up now since we're talking about it. There was a conversation that we had last week regarding LPNs going back to school for RN. The thing that I thought I said that didn't come out of my mouth, and I think that was confusing, was the thing that irks me about LPNs going to RN school is those individuals who specifically go to LPN school because maybe they didn't get the T's grade that they wanted, or they're trying to find like an easy way to get into RN school without having to do like extra work on the T's or their admissions or things like that. Because remember, admissions is very different for LPN and RN. The people that do that and do that, go to school for LPN, and then immediately apply for RN without actually working as an LPN. That's the situation that I don't like because you've taken a seat from somebody who actually wants to work as an LPN. LPN is a fantastic career. There's a bunch of people that do it and a bunch of people that love it. But I have seen situations specifically in Florida and having worked in healthcare and interviewed people where you'll see on their resume where they initially went to LPN school and you're like, okay, where's your LPN experience? And then immediately go back to RN school like the next semester. And I'm like, what happened? And they said, well, I didn't get the T score that I wanted. So I did LPN first. And then my school didn't require me to take T's again. So I just went straight into the RN program. That's what I don't like because there's a lot of people out there that really want to be an LPN and you've just taken a seat from them. So just to clarify what I said last week, LPNs work extremely hard. I don't have any issues with LPNs who have worked in the field that want to go back to school to get their RN degree later on. I just wish that if you are going the LPN route, that you at least work in the profession a little bit, like experience it, get that experience in the career and then decide to do RN, not use it as like a stepping stone for getting into the RN program when that seat could have been used for somebody who actually wanted it. So that was what I was trying to say last week, and I think it came out wrong. I did get an email from somebody who was a little upset, completely understandable. I take 100% accountability for what I said. I assume that's what I said. And then when I went back to watch the clip, I was like, that sounds really bad. Because you know me, I'm not, you know me. If you've been in any of my lives, you've heard me talk about LPNs and how hard they work and how integral they are to the healthcare system. That was not what I meant. Just a heads up. So sorry about that. Ness, and here's the deal. I do think that it is a great stepping stone. That's not what I'm trying to say. What I'm trying to say is that if you are the type of person that wants to actually do LPN, then do LPN 100%. But if you're only using it to get into RN school immediately and you've taken a spot from somebody who really, really wanted to be an LPN and work as one, that's my issue. That's my issue.
And the budget problem.
Budget
Because
problem for what?
you're doubling your school time.
I don't even care about that.
Yeah,
Because at the end
that's
of
the
the
other
day,
thing too,
it's more or less like because somebody could have used that spot that actually
Well, yeah.
wanted to do it.
Yeah.
Do you know what I'm saying? Like that's why I'm like I wish that that wouldn't be something people would do because you just take that spot from somebody and somebody would have really wanted that spot and didn't get it, you know. That's all I'm saying. Have to take my T's next month. Very nervous so I can enroll my LPN to bridge to RN. I love it, Marita. Yeah, I will tell you all, to be fully transparent, there's very few programs where they will allow you to not take T's again in between LPN and RN. So you most definitely, not always, but most of the time you will have to take the T's more than once if you go between LPN and RN. I was going the LPN route, but I'm just gonna knock out the prereqs and do the RN. See, and that's the thing. That's okay too, because some of us will look into like the differences between LPNs and RNs and like the scope of practice and the schooling. And at the end of the day, like if you really want to be an RN, just knock that T's out, get the score that you need, and get into that RN program. I think that's going to be huge, huge when it comes to saving time too, saving a lot of time. Do I think a CNA can just do I think a CNA can just go straight to RN? Yeah. There's a bunch of CNAs, patient care technicians, phlebotomists. I mean, there's like a bunch of different roles that can go directly into healthcare, specifically like RN. Absolutely. You don't here's the deal, y'all. You don't have to go the LPN route if you don't want to. So there's nothing wrong with saying, I just want to be an RN and that is what I want to do, right? At the end of the day, there's nothing wrong with it. There's also nothing wrong with saying, I want to be an LPN. I think that LPNs have a fantastic scope of practice and what they do. And that's what I'm going to go to school for. Like, there's nothing wrong with either one of those options. At the end of the day, it's just you pick what you want more, right? You pick which one works best for you. I'm gonna move my screens around. There we go. I was a CNA for 12 years, went to a different field, and now I'm registered for prereqs for RN. That's awesome. The Army has a fantastic LPN program. It's free and you get paid for it, then bridge to RN. That's great. That's great. Listen, the Army has a lot of like really good options. I had a friend of mine, his name was Aaron. We worked together in orthopedics, and he was actually an RN for I can't remember how long, but it was a while. Let's just say it was a while. And he was actually in something. I couldn't tell you specifically like what line of military he was in, but he was in something. And based on him being in that as well as his wife, they actually both went back to medical school, and their program that they had through that portion of the military paid for their entire medical school, which is great. So, I mean, hey, there's nothing wrong with that. Free education. I love it. What's the difference between T's and HESI? Great question. So T's is very academic forward, is what I'll say about that. Extremely academic forward, meaning that they're doing a lot of critical thinking. They're solely focused on if you are going to academically be able to maintain staying in these healthcare programs. Whereas with T's that are not T's, I'm sorry, with HESI is a little bit different. So they also do academic forward kind of testing, but they're also testing specific things on like what's your learning style, what's your personality type, like things that are going to help the programs gauge how well you're going to do in the program as well, but in a different aspect of it. So T's and HESI cover a lot of the same topics. It's just that some of the things T's covers, HESI doesn't, and some of the things that HESI covers, T's doesn't, right? So, for example, HESI covers like Roman numerals. You're not seeing that on the T's. It's just something that's tested under HESI. So, our T's lives are really good in regards to the fact that we cover a lot of the information that you're going to need to know, but you also, like we always say, need to reach out to HESI specific things to make sure you're not missing anything that we don't cover, for example. That's all. Should I do radiology or anesthesiology? Wow, those are huge, huge careers. Um, when you say anesthesiology, I'm assuming that you're specifically talking about like CRNA. I'm assuming is what you're talking about. Like I could be wrong. Uh it's really up to you is what I'll say. It's really up to you. I think that both careers have a lot of really good pros and cons, like any career, let's be honest. All careers have pros and cons. I think the biggest issue is the amount of money you're going to spend between those two programs because like CRNA is going to be very expensive, like very, very expensive. Um, like in our specific like guideline of like how we move up in the nursing career. So if you want to spend like a little less money and you want to do something like interventional radiology or something like that, that'll be a little bit less schooling and a little bit less money that you're having to pay up front. Whereas if you want to go like all the way and make the big bucks eventually with CRNA, then I would say go that route. I would say go that route, but completely up to you. What should I do after completing nursing at a community college? Apply for a job. That would be my biggest recommendation to you is like really get into figuring out what do you want to do. My biggest recommendation is usually I'll say like 2 to 3 months before you're about to graduate, start applying for graduate nurse positions. Some hospitals list them a little bit differently. Some of them will list them as graduate nurse positions specifically. Some will list them as RN residency programs. Some will list them as STAR programs. Don't ask me what the STAR stands for. That's something that HCA does. Some of them will list them as just regular positions, but they'll hire graduate nurses into it. But really start looking into careers options for you, usually like 2 to 3 months beforehand. Start getting those interviews in. That way, when you're done with your nursing degree, you have a job waiting for you and you're ready and rearing to go. But if you want to take some time off, you can do that too. My only recommendation is that if you want to take time off before you actually start your career, is to make sure you take your NCLEX as soon as possible. As soon as possible. The reason why is because I've had a lot of people who were in my program specifically that wanted to wait. They really wanted to study for it and they really wanted to like make sure that they were going to be prepared for this exam. And then all of a sudden, they got to the end like 6 months out from when they graduated and they had a really hard time passing the NCLEX because they forgot a lot of the things that they needed to know. So my biggest recommendation is to make sure that you take your NCLEX as soon as possible. And then if you want to take time off, you can do it after that. I keep pulling my hair out and my glasses. Y'all, I need new glasses. They're driving me insane. There we go. Can I do NICU for CRNA school or just ICU? I've seen NICU nurses do CRNA school. Um, I don't think that there's anything wrong with either one of those options. You're taking care of high acuity patients. It's just a different patient population. You're either doing neonates or you're doing adult or even like pediatric if you wanted to do pediatric ICU. I don't think that one is like looked down upon versus another. So I think you should be okay. Oh. Would I recommend going straight to ADN after doing surgical tech program? I mean, you can. You can. I mean, yeah, if you wanna do if you here's the deal, sometimes we change our mind, right? So sometimes, like, we get into a career so, like, say, for example, you're doing, like, surgical tech or maybe, like, LPNs get into LPN, they do LPN school, and then they're just like, "You know what? This isn't for me, this is not what I wanna do," and then you go back to school to do something else, and that's completely okay. I don't think that there's anything wrong with changing your mind about what it is that you wanna do, what it is that, your passion is as you're moving forward in healthcare. I don't think there's anything wrong with that. So if you did surgical tech program and you're like, "You know what? This is not what I signed up for. This is not really something I wanna do." There's nothing wrong with going back to school and doing something else. As long as you made that decision when you were in the school and you're like, "You know what? Not for me." Exams, exams, exams. That's the healthcare programs. I agree. Always.
Can you talk about the T's and what we offer
So some of you are asking about what our T's resources are. So we have a bunch of different things. We've got study guides that we have freebies, we've got videos on the subject. We've got live replays. We've got all kinds of stuff on Tees. So if you're interested in how to get the study material, I'm going to put a little pin for my TikTok folks on the bottom of our screen. You can go ahead and click on that. And that Mr. Chung sitting right next to me, he can help answer any questions you have regarding Tees materials. Do I have any materials that will help prepare for nursing school? Not yet. Honestly, y'all, let me tell you something. It's hard. It's hard being me. The reason why is because I want to do so much. So, like, I want to create a nursing resource for you, or nursing school resource, a nursing resource. I want to do like a guide for like your prerequisites. I want to do videos on those. There's like so much that I want to do, and then I realize that I still have a 9 to 5 job. Right? So I still have like a 9 to 5 job that I have to do regularly, and that affects me being able to create a lot of things. So is it something that I want to do? Absolutely. Absolutely. But I just don't have it yet. I'm sorry. My hope is that, one day I'll get caught up on the things that I want to do and get those things done for y'all, because I think they would be really, really good resources.
Do you have any tips for high school students shadowing a med surge nurse?
Do I have any tips for a high school student that's shadowing a med surge nurse? My biggest tip to you is to be curious. The reason why, and I think that it happens a lot, is that in our unit specifically, where I used to work, we had high school students come all the time because we had so many high schools around the area, and they would come to our unit all the time. And then what would happen is that high schoolers would be like really scared to talk to anybody, because you're going from like that high school to very adult practice kind of world. Maybe a lot of you haven't even worked yet. Like maybe you didn't have a summer job, or you didn't really have any of those experiences. So like trying to have a conversation initially is a little like scary and intimidating, because you are like you're in the healthcare world, you're in that career now, and you're like, oh. But here's the deal: the more curious you are, and the more that you ask questions, the more that you're going to learn. So I think that's the biggest thing, is that if you're wanting to shadow medical surgical nurses and see what they do and get an idea of like why they're so important and things like that, the number one thing you have to do is be curious. Like ask your questions, ask to see certain things. Like, oh, I've never even heard of that. Can I see that? Can I watch that? Like you don't have to stay with the person you're with. You can go with another nurse to experience something. But the more opportunities you seek out, the better off it will be. And then getting past that imposter syndrome, whether you're in high school or you're in nursing school or you've become a brand new nurse, syndrome is real, y'all. Imposter syndrome is real. Like we've all experienced it, right? We're just like, I don't understand how this person's so good at what they do and I'm like struggling, right? It's kind of like that. And you just have to understand that you are in chapter 1, or you can even say like you're in chapter 0, right? You're just starting. You can't compare yourself to somebody else's like chapter 10, chapter 20, right? It's going to look very different. They were where you were at some point, right? They were in high school, they were in nursing school, they were a brand new nurse. They were in that situation before, and that was their chapter 1. It's just that they've been doing it for a little while, so they have more experience. So they're in a different chapter in their lives. They're a little bit further along than you. So never compare like your beginning to somebody else's like midway point, you know? That's the biggest thing. Noise like, but I'm shy. No, you're not. No doubt about that. Let me see. Nurse Chung, I got into nursing school. Your videos helped me so much on the T's. You're welcome. Huge congratulations to you. That's great. Any tips on differentiating between relevant and versus informative fluff for exams, highlighting a lot? Anthony, that is everybody's issue. If I'm being fully transparent, when I first got my textbook, I was literally highlighting everything. Why was I highlighting everything? Because I didn't know anything. And I was just trying to figure out like what I needed to know. So this is my recommendation with studying, especially when it comes to like nursing school stuff, is number one, read the beginning of the chapter. So usually at the beginning of the chapter, there might be like a little box or something that talks about like key terms, key words that you're going to need to know, maybe key concepts that they're going to discuss in the chapter. That stuff's going to be important. Then I want you to scroll through the actual textbook, and I want you to look up specific things. So, usually there's going to be highlighted words or italicized words or underlined words. Those things are important. They're highlighted for a reason, or they're different for a reason, because it's going to be important concepts and things that you're going to need to know. Make sure you're looking at all the boxes and the diagrams, not necessarily all the words, but just like the boxes and the diagrams, stuff in there is going to be very important. And then at the end of the chapter, there's going to be like a summary of everything that they talked about. That'll also give you a really good idea of what's important when it comes to concepts and things like that. Once you've done that, my biggest recommendation to you is to go find a video, because I don't know if I'm like you, my TikTok folks, my YT folks, my IG folks. Are you a book person or are you a visual audio person? Just put that in the chat for me. If you're a visual audio person, like give me some hearts over on my TikTok side and my on my YT side, because I can almost guarantee you that there's a large percentage of you that wants nothing to do with that textbook. Right? So look for videos online. There's a ton of educators out there, myself included, that have created videos on different concepts that you're going to learn. You are 100% going to learn way better doing that than spending your time trying to read a textbook that's long, that's fluffy, that's irritating, that is not going to get you the information that you're going to need in order to be successful in nursing school. It's just not. Because I feel like I'm falling asleep at the end of the day, right? See, Mika says I love Dr. Mike videos, right? He does a lot of education stuff too, in a little bit of a different way. But I mean, a lot of his stuff is very educational. Same thing. It's just that you've got to find the stuff that's going to work for you. And 9 times out of 10, it ain't going to be that textbook. Because I can tell you right now, my entire time I was in nursing school, I think I maybe opened up the textbook 10 times a semester. And that was just to look at the chapter outlines. That was it. Everything else was either video or some other kind of study method. I just couldn't do it. So that's my biggest recommendation is get to know your educators, get to know get to see those videos. What do I think about the new Department of Education advanced professional changes? Oh gosh. So I know that the Department of Education came out with guidelines that they are trying to pass or get approved to eliminate advanced nursing practice degrees from receiving federal aid. So, like financial aid, things like that. So you'll still be able to get those degrees. Those degrees aren't going away. CRNA, NP, clinical nurse specialist, like all of those advanced degrees will still be there. It's the financial aid that's affected. The problem is, and the reason why I'm a little like irritated about it is because when you were going through those programs, nurse practitioner, CRNA, I don't really know about clinical nurse specialist because I never was one or never attempted to be one. It's going to be very difficult for you to work while going to school. It's almost like doing nursing school all over again in a different way, right? So in those situations, now you're no longer receiving financial aid, right? So you're having to figure out how you're going to make it through and pay for these classes and pay for these books and pay for your education at the end of the day, and continue to pay your life, the things that are around you as well, because you're not working full time. So I don't agree with it on my end. I feel like advanced practice degrees are just like having an associate's degree, like having a bachelor's degree, where you're not really able to necessarily work depending on the degree that you're doing, because you're learning so much and there's so much going on at the exact same time. So I feel like by doing this, we're going to deter a lot of people from wanting to advance their degrees, to want to become an NP, to want to become a CRNA, or so on and so forth. And I think that we're going to lose a lot of people in the process because they're not going to be able to financially
Assist them to grow.
is not that, to like financially I wish you wouldn't talk when I'm trying to like say something. I lost my thought. they're not going to be able to financially take care of themselves and their education at the end of the day. And I think that's the problem. I think that's the biggest problem with me, and why I'm just kind of like, right now, nursing is taking a hit, y'all. If we're just being completely transparent, nursing is going through a lot, right? We've got a lot of people that are striking because of like nursing staff patient ratios and like poor working conditions and things like that. We've got people that are stealing other people's licenses and practicing on their license. I think there was like a new situation in Louisiana fairly recently that this individual was practicing under somebody else's license for a period of time. They just got caught. Florida, it seems like everybody was doing it down here, for being fully transparent. Um, and we've got just this turmoil that's happening in healthcare. And it's just kind of like, well, let's add on to that and let's take away funding for advanced practice degrees. It's just like, I don't know what's going on in healthcare, but it's crazy. It's definitely crazy. So yeah, I have a lot of opinions on it. It's frustrating. It's frustrating. I can just put it that way. But yeah, I'm not happy about it. If that if that was your question, I don't think that I don't think that that was a good time to try to implement that. Am I Korean? No, I'm actually Caucasian. I'm white. My husband is from Hong Kong. So when we got married, I became Mrs. Chung and took on that name, and then this became Nurse Chung. I have anxiety panic disorder. I hope I make it through nursing school. This is what I will tell you. I also suffer from anxiety that leads to panic disorders. If you can ask Mr. Chung, he's seen a lot of it at the end of the day. And I had it when I was going through nursing school too, especially when it came time for testing. Horrible anxiety when it came time for testing. What I will tell you is that it'll get easier. You're still going to struggle with it. It's not going to completely go away. You're still going to have it. But the more that you're exposed to things, the more that you do things repetitively, the more it becomes a routine and the less the anxiety becomes. It's just that you have to kind of get over that initial hump of being anxious and having that severe anxiety. And once you develop that routine, to be honest, you're going to be so overwhelmed and so like jam packed with a schedule and things that you're going to have to do that you're just not going to have the time for the anxiety to even happen, to be honest. That used to happen to me when I was on the floor a lot, is that I would get anxiety like as soon as I got to my shift. And then about like 10 o'clock, I wouldn't have anxiety anymore because I just had so much going on that I just didn't even have time for it. How did some of the single moms do it? I'm having a hard time completing my prerequisites. That's a great question. I only had one person that was in my nursing school class that was a single mom of two while she was going through nursing school, and she worked per diem. So she thankfully had a lot of help from her family. So like her mom, her dad, she had some siblings that could also help. She also looked into like daycares and things like that, after school programs, to kind of help her get through. She was also very vocal about it with her professors and the people that she was in nursing school. So that way they were aware of what was going on so that they knew like what she was doing. But yeah, she worked per diem as much as she could through nursing school to kind of make it through. It's possible. It's definitely possible. Best study resource for CCRN, not too much fluff, but lots of realistic practice questions. I'm going to be 100% transparent with you, TK. There's none. There's none. When I studied for CCRN, I looked at a bunch of different resources. I think I had three. I think I had three different resources that I was using for CCRN, even like from the maker of the test. Even that like type of resource. They have like a little booklet that they give you that breaks it down. None of them, it was either it was way too much information and you were like, "Oh crap. That's way too much. I'm never going to learn all this." Or it was just like so limited information that it wouldn't have helped you pass. had you just read the material. So unfortunately, as of this moment, I don't think that there's any good resource out there that I've seen personally. What are my thoughts on oncology? This is what I'll say about oncology is that oncology is hard. Oncology is hard. So I did oncology PCT at nights when I was going through nursing school, and let me tell you, it was either like patients that were like devastated and that were really really sick, or just like they couldn't come to terms with what was going on, and like mental health was like really bad. Or you had another population where they were like, I'm going to get through this, I'm going to do amazing, I'm not going to let this beat me, so on and so forth. They just had like a really positive outlook on it. So when you have those positive outlook patients, it helps tremendously. But when you have those patients that are just like they're going through it, their mental health is taking a toll and it's really, really hard, that sometimes can pass on to you, right? That can pass that on to you. So I could tell you that when I went home in the morning, just seeing what I saw every single night when I was working took a toll on me really, really quickly, very quickly. Because there were some people that just like they couldn't even take care of themselves. They couldn't move. They couldn't turn themselves. They just like they were just literally like it was like being like a brick in a bed, right? They couldn't physically move, either because of the pain or they just gave up. Right? Mental health. I don't think that people talk about mental health when it comes to healthcare, especially with our oncology patients, enough. I don't think that we do, because at the end of the day, like they're going through a lot. So if you are the type of person that can separate yourself from that, or you have a really strong desire to care for cancer patients, either because you've experienced it yourself or maybe you knew somebody who experienced it, I think that you're going to do amazing in oncology, but you just have to learn how to separate who you are from what's going on in the hospital. Like you've got to have your personal life and you've got to have your professional life. And sometimes that can be really difficult for people. What program can we do to prepare for nursing school after T7? I don't have a specific recommendation. I do recommend the Saunders book. That is something that I personally used when I was in nursing school. I don't know how good it is now. Obviously, it's been 14 years since I've been in nursing school. But when I was in nursing school, it was really, really good. It helped me figure out how to answer questions and things like that. But I don't have like a specific program for nursing school itself. I know that there's like a whole bunch of them out there. There's a whole bunch of like courses and memberships and things like that. I can tell you that I've purchased some of them just to like see like what they're teaching, what people are learning. And I can tell you that a lot of these memberships are teaching like incorrect information or information that's no longer valid, meaning that evidence based practice, you're going to hear this constantly when you're in nursing school. Evidence based practice changes all the time. So something that might have been good back 10 years ago is no longer good now. So say for example, Foley catheters. Back when I was a nurse, in my beginning days as a nurse graduate, we used to put the saline into the catheter to blow up the balloon to make sure that the balloon was intact. Well, now, based on evidence based practice, we no longer do that because there's been a lot of evidence that it's torn urethras, that it's caused unnecessary damage. By putting the catheter in after you blew up the balloon, right? There's been people that maybe didn't know how to take all the saline out of the balloon when they pulled it back out. So now you're putting like an even thicker catheter into somebody, which can cause damage. There's a number of things. So that's why they don't recommend it anymore. But I went into these memberships and they're still teaching that. They're like, yeah, put the saline in the balloon before you insert it. No, evidence-based practice says don't do that. So that's why like I'm a little iffy on some of these memberships because they're teaching outdated practices because they probably haven't been at the bedside or worked in healthcare for extended period of time. So right now I don't have anything that I can recommend just because I've just seen too much that is inaccurate. A lot of inaccurate information not based on current evidence and what's actually being done in practice. Yeah, so a lot of people that also passed the CCRN said that the questions weren't great. Yeah, and that's the thing, they weren't great. I got their questions, and I don't feel like it really helped me to be 100% transparent. I just basically looked at what the test outline was and then studied what was on the test outline, and I passed it my first try. And to be fully transparent with you, CCRN now is doesn't require as many correct questions as it did back in the day. So when I took my CCRN several years ago, I had to get way more questions correctly than they require now. So do it now while they don't require you to have as many questions correct before they like bump it up or whatever they do to it, because I would have completely annihilated that test had I had, regardless, I still passed it the first time, but I would have done way better if I would have taken it now versus back then. What should I focus on when it comes to medical terms and math competency? Medical terms, you're gonna have to know everything to be fully transparent. When it comes to medical terminology, my biggest recommendation to you is to make flashcards or something where you can just repeatedly keep testing yourself on these terms. The more that you use it, the second nature it'll be. It'll become just practice at that point. Um, but 100% medical terminology is just something that you have to memorize. And when it comes to math competency, practice makes perfect at the end of the day. The more you practice, the better off you will be, the better off you will be able to answer those questions in the future because it'll become like muscle memory. So practice when it comes to math competency, and flashcards or something where you can repetitively keep practicing with medical terminology. Do I have any videos on dosage calculations? I do. I'm actually going to put a little box on the bottom of your screen for my TikTok folks. Right here, you're going to see that little direct message pop up. You can direct message Mr. Chung. He's sitting right next to me. He can help answer any questions you have regarding like T's study material, all the resources we have for that, dosage calculation. If you're going to be doing your BLS, I have a video on that. I have like a whole bunch of videos. You can just ask him. He can point you in the right direction. Did I work when I was in nursing school? Because I'm planning to do so, but people keep saying that it's not possible with high grades and the work at the same time. I will tell you it's very difficult. I'm going to be fully transparent with you. Working in nursing school is going to be hard. I did it for 2 semesters and then gave up, and I didn't work again for the remainder of my program. But I was doing a specific program where I was doing my associates and bachelor classes at the exact same time. So I was doing way more than you typically would in associates or traditional BSN program. So that's the reason I couldn't do it, but that's not to say that you can't, because there's a lot of people who can. Are you going to have study guides alike for T7 material for nursing students in the Are you going to have study guides that are like T7 material for nursing students in the program? That is my goal. That is my goal.
Yeah, but EKG, ECG kind of.
Yeah, so I do have an ECG, EKG, like comprehensive guide that came out with a video that goes along with that. That kind of breaks down all of those different concepts. That's out. But yes, I am working on nursing school videos. Those will be coming out your way very soon. These videos are going to be very interactive, y'all, because if I have to read another PowerPoint or see another PowerPoint, I'm pretty sure that y'all are going to come at me. I know you're going to come at me 100%. So these videos are going to be very interactive. We're not going to be doing the PowerPoint style. We're going to be doing the teaching style, so that I hope you like them. If you hate them, you can let me know. If you like them, you can also let me know, but we are going to try to make them as interactive and as fun as possible. Is my partner Chinese? He is. He is. What made me choose nursing over other fields? That's a great question. I went back and forth in my career. I wanted to be a veterinarian. I wanted to be a doctor. I wanted to be a I wanted to work in forensics. I wanted to work like at crime scenes. I have this like obsession with crime scenes or and documentaries and stuff like that. There's a lot of things I wanted to do, and to be honest, when I was going through my prereqs, I probably changed it at least 4 or 5 times. Um, Based on what I was feeling in that moment. But this is what I'll say. I ended up choosing nursing because when I did the research on the things that I could do in nursing, That was when I decided, yeah, this makes sense. This is what I need to do. Because if I wanted to do nursing and do forensics, there is like forensic nursing, right? There's like specific careers for that. So I could expand in that. I could be a bedside nurse. I could work in concierge. I could do travel nursing. I could do hospice care. I could do education. I could do CRNA. I could do MP. There's so many things that you can do in the nursing field. It was just insane to me. So I was like, why wouldn't I do this? Because now I have the ability to move up, move out, move sideways, move back, move down. Like I had so many options available to me by being a nurse. 100% I recommend it all day long. It's going to be hard. Nursing is hard. 110% nursing is hard, but it's what you make it. It's what you make it. How do I feel about nurses eating their young? It happens all the time. It happens all, I wish I could say that this never happens, but it does. It happens a lot. This is what I will say. If you are in a situation where you are the young that's getting eaten by a more experienced nurse, document everything. If it's becoming bullying, if it's becoming uncomfortable, document everything that's happening. Document dates, document times, document conversations, document what you talked about, like everything, document everything. And then go to your management. Tell your management, this is what's going on. I don't feel comfortable. Like keep going over what's going on with this particular person. If you have good management or good leadership, they should find a situation where they can get you out and maybe put you with somebody else because it does happen. If you're in a situation where management's like, that's just the way they are, you'll be fine, just keep pushing through, then you might have to like look at the situation at face value and say, is it safe for me to stay here? Or would it be a better situation if I leave and then go do something else, go someplace else? That might be the answer that you have to do. And I hate to say that. Um, but it's unfortunately like, it's just, we can't change who that person is. At the end of the day, it doesn't matter how many times that manager talks to them about what's going on. Sometimes them talking to them will actually make the bullying or the argumentativeness worse, right? It might actually make it worse. So that is what I recommend is to just document everything so that you have anything and everything. Even if you could email it to the manager and just be like, hey, I just want to have a conversation about this. This is what's been going on. And just like break down everything so that you have a paper trail. That's even better. I always recommend that you blind copy yourself, your personal email, because if anything was to happen, if the nurse manager was to say, we need to let this person go, they're not meeting goals, and then you don't have access to your email anymore, you can't prove any conversations you've had with management. So I always blind copy myself so that I have documentations personally and professionally of situations like that to protect myself. Because at the end of the day, you've got to protect your license at the end of the day. But it does happen a lot. This is what I will also say on the other side of it. So right now, you all are very aware that healthcare is having this massive shortage. Healthcare is not really having a shortage. We're just having a lot of nurses who are refusing to work or don't want to work in the field, right? Because their boundaries have been crossed one too many times and they're like, I'm done at the end of the day. But right now we have this shortage of nursing professionals who are willing to work. Let's put it that way. Crazy ratios, exactly. That's one of the reasons a lot of people have stepped away. Because of that, there's a very few qualified preceptors in certain units that are able to precept. And if you've got a unit that's very short staffed, they're going to get overloaded very quickly. So that might mean that somebody is going to get put with somebody that doesn't even want a precept in the first place. So you might be in a situation where you have a nurse who's eating their young and they were voluntold meaning that they didn't volunteer. They were told they were going to volunteer to precept these nurses to get them competent enough to be successful on the unit. And when that happens, you are kind of put in between that. You're being put in between the manager that told them they had to do it and the nurse that said they didn't want to do it, and now they're being forced to precept. So you have to kind of look at it in that aspect too. It's not great, but it is what happens. That was my biggest frustration as a nursing educator on the floor was when all of my good, nursing preceptors were being used and I had to onboard more and more people and I didn't have anybody qualified. I got stuck with the less stellar, preceptors, and unfortunately it happened, and I had to have many old conversation with nurses about it, and it's frustrating, especially like when management pulls the good preceptors to be charge nurses or they want them to do other things because they've been proving themselves on the unit. So then they take your preceptors away. Like it's a constant cycle. It's just a cycle that keeps happening over and over and over again. And that's why we have nurses that eat their young and that they didn't want a precept in the first place. You have to kind of look at it from that aspect too.
What are some more laid back nursing job slash profession?
Some laid back nursing jobs or professions. If you want to do, there we go. If you wanted to do like some kind of concierge nursing, so concierge nursing, like IV treatments, maybe going into someone's home and you only have that one patient the entire time, that could be a more of a laid back situation. Case management is also another great option as like a laid back type of nursing career. PACU, a lot of ICU nurses end up going to PACU at some point because they actually take their lunch breaks. And they usually have like a set period of time that they work. Not always, but a majority of the time they have a set period of time. So like PACU is another big one. A lot of nurses do like IV therapy. School nursing, it
Yes, it
depends.
depends. It depends on your
It
area.
depends because I'm telling y'all, I've spoken to some school nurses recently, and some of these kids are crazy, y'all. Some of the stories I've heard about kids from school nurses, I'm like, oh my gosh. So I don't know if school nursing would necessarily be a laid back thing. You might have periods of time where it's kind of laid back, but like computer nursing, nursing education sometimes depending on the education that you're doing.
I think medical sales is fun if you like to
Yeah,
learn,
medical sales is fun if you're like a go-getter and you like talking with people and things like
talking with
that.
doctors.
Educating people. I mean, there's a lot. There's a lot. You just have to look into what one works best for you. Mother baby, yeah, mother baby, depending on like it depends on the mother or the baby, right? It depends. Like typically, yeah, it's pretty laid back. But you've got some days where it might be very overwhelming. And NICU, I think NICU would probably be another kind of, I wouldn't say laid back, but you do usually have like a few infants that you're taking care of, so it's not like extremely overwhelming. But babies can go bad like really quickly, right? So children, the thing about children, infants, neonates, whatever, is that they compensate for a really long period of time before they eventually just collapse. Right. And then that's what happens. It happens a lot because they're just so good at compensating. As adults, like we don't compensate very well usually. So we go bad over like an extended period of time. But kids, you could be taking care of a kid. They could be playing and laughing and really excited. And then like a minute later, all of a sudden, like they're blue. It's just crazy how that happens. Tease resources. If you're interested in like tease resources, the videos, the study guides, things like that for my TikTok folks, I'm going to put a little direct message at the bottom of your screen. That's where you find the tease information. Mr. Chung can help answer those questions. Also, like, where can I find the dosage calculation videos, nursing school videos, ECG videos, all of that stuff? Mr. Chung can help answer that for those of you who are asking where those things are.
How do you prepare for program interview?
Um, So it depends on like what you're interviewing for because every interview, especially with the schools, are going to be very different. A lot of them are going to ask the same questions. Why do you want to go here? Why do you want to be a nurse? Where do you see yourself in several years? Like what are your ambitions? What are your plans? Like those are always like the typical things. Sometimes they're going to ask you about like previous healthcare experience? Like, have you worked as a CNA? Have you done PCT? Have you done any of those careers? They might want to know about that. They might ask you about like previous like work experience. And then might ask you like clinical questions. Like they might ask you like anatomy and physiology questions, how the different systems work, and like to kind of gauge like where your knowledge is. That's why I always say like know anatomy and physiology like the back of your hand, because at the end of the day, A&P is going to be very important. I had somebody reach out to me, I want to say it was a week ago. And they were basically like, I didn't study any of the A&P for the T's exam because I don't think that it's important. And I said, "Why don't you think it's important? I don't understand." And they said, "Well, I'm not going to really use it when I'm in nursing because when I get into school, I'll have, I'm just going to study and memorize everything, and then once I don't need to know it anymore, I'm just going to forget it." I mean, I was flabbergasted. You're going to use anatomy and physiology, especially if you're going into nursing, your entire career. Your entire career, you're going to use A&P. So it's very important that you learn anatomy and physiology now before you even get into nursing school. Because what I'll tell you, if any of you who are in nursing school right now, you know that your teachers will do one of two things. They're either not going to teach you the information because they're going to tell you, oh, read the textbook, or oh, read the PowerPoint. You should already know anatomy and physiology because you've already taken that class. So that's number one. Or number two is that they're going to basically be reading off the slides and not answering any questions outside of what's on the slides. Or number three, they're not going to know the answer. They're not going to know the answer to a lot of these questions. So that's why you've got to know anatomy and physiology. But yeah, they might ask you questions like that for your nursing school interview.
So someone been out of school for a little bit and trying to decipher, like, they're second guessing if they want to do nursing or not. So is it a nerve of change or true feeling? How can you know that's your calling?
I'm gonna
It's a
read. I'm
second.
gonna read the question because the way you just said it, I
Okay,
didn't
I
get
know.
anything.
That's okay.
So I see Daniel. I see Daniel that asked it.
Thank
So
you.
Daniel says, "I'm really second guessing if I want to do nursing. I've been out of school for 10 years, so I'm trying to decipher if it's just nerves of change or true feel. Any advice on how to discern the truth?" Here's the deal. Whenever you are trying to change careers, changing careers is scary because you're going from something that you have a really good grasp on to doing something that's totally new that you might not have any clue about, right? But you know that you might want to do nursing specifically or do healthcare because of the longevity of healthcare, right? When the COVID pandemic happened and all these careers kind of came to a close, what was the career that stayed, that was still working? That was essential. Remember, we were like essential workers during the COVID pandemic. It was healthcare because people still get sick. People still have to go to the hospital. People still have to get their doctor's offices and things like that. Those things still exist even when the pandemics happen. So when you are trying to find a career that has stability, which is what I'm assuming a lot of you like, is the stability and the money, if we're being fully transparent, then yeah, trying to figure out if this is the right choice for you is questionable, right? Is this actually going to be worth it? So this is what I would say. Whenever I have a hard decision I have to make, I sit down, and Mr. Chung is gonna laugh because when he hears this. I sit down, I get a piece of paper, and on one side I write the pros, and on one side I write the cons. And what I do is I write everything down on the pro side that I can think about. Why do I want to do this? Money, career stability, advancement opportunities, whatever. It's going to be different depending on what the pros are for you. And on the other side, I write all the cons, right? Maybe I'm going to be new to this. I don't have any clue about this. I'm not 100% sure if I like this. Maybe blood isn't your thing. You're like, I don't know if I really want to deal with blood. Like, write all of that down. And if your pros outweigh your cons, do it. Do it at the end of the day. If your cons outweigh your pros, then you might have to think about it a little bit, right? Like, is this really worth it then at this point? This is what I will tell you. Nursing 100% of the time will always be worth it because of what you can do. The nurses that are out there right now that are refusing to work bedside because they're just not going back into the hospital environment, believe that they are doing something. They are doing something, right? They're either doing influencing, nursing influencing, they're doing hospice nursing, they're doing concierge nursing. Maybe they're still doing bedside, but they're doing it the travel nurse route because they refuse to get paid unless they're a travel nurse. They're doing something that's out there, right? You have the availability and so many opportunities that are ahead of you when you are a nurse in comparison to a lot of other careers. So, would I do nursing school again? Absolutely not. I was traumatized. I'm not doing it again. But because I've done it, was it the right decision? Yes.
Before I before we stop about that. So when you talk about your pros and cons, make sure you have a unbiased source look at your pros and cons list. Because Nurse Chan, when she do pros and cons, is very biased. Instead of
It's
fact,
my pros and cons.
yeah, but sometimes you like over put certain area compared to the others, so make sure you like double check with a couple people, like someone you trust, to really dissect the pros and cons list. Is it like a bias or like is it fact? Because sometimes because emotion get in, you're writing it in a down moment or whatever, sometimes you outweigh something one way or the other. Just FYI.
Listen, they're your pros and cons. Mr. Chung likes to like look at my lists and be like, "Oh, this isn't really a pro. This isn't really a con. It's my list. My list." So if I think it's a pro or I think it's a con, it's a pro or con because it's my list. It ain't your list. You make your own list.
Yeah, we make our own list and then we compare. Exactly. Thank you.
Listen, and let me tell you something. When you're going through nursing school, if you haven't yet or if you are about to, nursing school is the leading cause of breakups and divorces. I'm just putting it out there. Not that that's what's going to happen here with me and Mr. Chung, but nursing school is the leading cause of either relationship breakups or divorces, right? Marriages breaking apart because nursing school is really, really hard. And you've got to have a really, really strong partner that is going to support you throughout your entire nursing school journey. And that's hard sometimes. When I was going through nursing school and I was in my first semester, I had a boyfriend at the time, and he told me it was either him or nursing school. That wasn't a hard decision. I picked nursing school. But it's just the point that like a lot of people feel insecure when you don't spend enough time with them. And unfortunately, nursing school is just one of those things that it might be really difficult for you to spend a whole lot of time with your partner. So, the time when people start getting back together is at the end of nursing school. So when you're like in that final semester, when you're going through practicum, that's when people start showing back up and they're like, "Hey, this person's about to make some money. Let's get into a relationship." That's when you need to be careful. That's when you need to be careful because that's the time when all these players and these money hungry people don't necessarily want you for you. They want you for what you can give. And there ain't nothing wrong with that if you're the type of person that like wants something or they have certain expectations, but it might not be the best situation for you. So just be cognizant of that.
Man, we got a pass train right here in TikTok. Everyone passing the teeth with you.
Oh my goodness. I see that Tay passed their T's with an 83%. I see Paige passed their T's this week because of the videos and the study guides. Woo! I see that Ashma, thanks for teaching so nicely. I passed my T's watching your videos. Maya got into nursing school with the study guides. Oh my goodness. Wow. So, first of all, huge congratulations to you that used the study guides in that pass and they're getting to nursing school. That's great. If you all are interested in the study guides, because I see some of you saying study guides, little bottom of your screen, it says send me a direct message. You can click on that. Mr. Chung can help answer those questions on study materials and the resources that we have. We have a bunch of free resources, a bunch of paid resources. We got all kinds of stuff. So if you're interested in that, nursing school topics, anything like that, Mr. Chung can kind of help answer those questions for you. And thank you for the super chat, Ajma. I appreciate you. Am I a DNR? No, you resuscitating me. The only way I would become a DNR is if my quality of life was like deplorable and I wouldn't have I would just I would not have a good quality of life. That is when I would look at DNR. But no, you resuscitating me. Bring me back to life. I still got things I need to teach, uh, resources I need to create. They want to take advantage of compassionate people. Completely agree. Completely agree. ED or psych? Listen, if you work in the ED, you get both. um, here's the deal. I worked for a hospital that was in a not so stellar area in the ER, and we had a specific area in the ER that was specifically for psych patients. So if we had like a concern that somebody might try to elope with an IV or that they were going to have like some kind of psych episode where we needed to keep them safe, we called it the Crystal Palace. Is what we called it because I had a whole bunch of windows so that everybody could look inside. And that's where the psych patients went. So if you're trying to decide between ED and psych, you might want to pick ED because you're going to see both ER patients and psych patients in the ED. But if you're the type of person that just wants to like take care of psych patients, do psych. There's nothing wrong with either one. My hospital has a zone for psych patients in the ER. See, I'm telling you, you get the best of both worlds.
Especially night shift.
Especially night shift. Night shift we would have like we would have people that had like bang bang wounds. I don't want to say the word because I don't know if like TikTok's gonna block me. But they had bang bang wounds. They would come in with like legs in places they weren't supposed to be. Like a lot of traumas happen at night. People losing fingers from fireworks, like all kinds of stuff. You want to have real fun, work night shift in the ER. Oh, Ashley, you're so sweet. Yes, do nursing school.
What department have you worked in?
What departments have I worked in? Oh, wow. So when I first, I worked at so many. So when I first became a nurse, I was a orthopedic medical surgical RN. I left that because that was not like my passion. It was just something that got me into healthcare so that I got experience. Then I went to work in the ER. Went to work in the emergency department. I did travel nursing shortly after the ER. Doing that, I did PCU. I've done ICU. I've done CVICU. I've done trauma ICU. I've done level 1 ERs. I've done CVPCU, nursing education, nurse management, corporate nursing education. Oh, I think that's a majority of it. Medical, surgical. I've done it all. I've done it all. I have not worked with babies. I did a clinical rotation when I was going through my mother baby class, and I was in the labor and delivery department, and I witnessed the birth, and it traumatized me for the rest of my life. So I didn't want anything to do with the labor and delivery department. If you are a part of it or want to be a part of it, more power to you. To each their own, like everybody's got different passions. That was not one of mine.
Someone interested in pain management, where should they work to get most exposure? What unit department?
To be honest, I don't know.
Okay.
Here's the deal, y'all. Something that is very important for you to learn in healthcare is that if you don't know the answer, it's okay to say you don't know. The number one thing I would follow up with is like, let me research and find out. But I can tell you, like, specifically pain management, I don't have a whole lot of experience with that. And I wouldn't really be able to know where to tell you to work to get the most exposure to it. So, unfortunately, this is something outside of my expertise that I wouldn't be able to answer, unfortunately. Is CCRN something only after nursing school? Yes. You have to have certain things. There's certain requirements that you have to meet. I'm going to tell you exactly what it is. So when it comes to CCRN, in order for you to be able to sit for the test, you have to have one of two options. Option number one is a 2-year option. So you have to practice as an RN or an advanced practice RN for 1,750 hours in a direct care of acutely or critically ill patients within the previous 2 years, right? Or you have a 5-year option where you have to be an RN or advanced practice nurse and you have practiced in the previous 5 years with a minimum of 2,000 hours in direct care of those individuals. So you cannot sit for the critical care registered nurse certification until one, you're already a registered nurse, and two, you meet the requirements in regards to hours. Sometimes they even make you like you have to submit like a letter of recommendation from your manager if you've taken the CCRN like a certain number of times to prove that you have the experience in the field to actually take the test. Because there was one person on our unit that had taken the CCRN, I think 2 or 3 times. I want to say it was like closer to 3 times, and they weren't able to pass it. And before they could test again on that fourth attempt, the nursing manager or educator, aka me, I had to write it. Had to I did. I had to write a letter. You remember that? I had to like that letter. I had to write a letter for this individual stating that they met the requirements in order to retest. Because they kind of use like an honor roll system in the beginning, but if you're unsuccessful after a certain amount of attempts, they make you take it again. Or they make you do the you know what I mean. They make you write the letter of recommendation from your manager.
Hmm.
I'm in the RN program now and it's a nightmare. The RN program is difficult. Is difficult. That's why I always say, like, if I had to do it again, would I do it again? Absolutely not. I would not do it again. But I'm glad I did it. I'm glad I did it. And I'm glad that I pushed through and that I got it done. But the RN program it's chaotic. I mean, you're dealing with a lot of miscellaneous things at the exact same time, right? So you're dealing with your classes, you're dealing with exams for those classes, you're dealing with assignments that you have to do with those classes. There's going to be simulations that you have to attend. There's going to be checkoffs of those simulations. You're going to have clinicals that you're going to have to go to. You're going to have to write papers and things for clinicals. There's just a lot of things that you're going to have to do in addition to regular things like studying, making sure that you know the content, sleep. I mean, sleeping wasn't a big deal when I was in nursing school. I didn't get enough of it and I just kind of dealt with it. But there's just like a lot of things that nursing school puts on you, which is why it's like one of the harder degrees to take out of like a lot of different degrees. So I completely understand you. I've been there and I know the struggle and I'm sorry that you're going through that. Out of all the different nursing careers you did, which was the most and least stressful? The least stressful for me so far has been corporate nursing education. For real though,
Yeah, yeah.
because you're not dealing, I mean, you're still dealing with administration, but not in the same way you do when you're working on the floor. It's like it's a little bit of a different aspect. Plus you like sometimes you can do a hybrid like I do where I work from home a period of time and then I have to go into the hospital for a period of time. Like it's like I have the ability to kind of do both and make my own schedule. So I think for me that's been the least stressful. The most stressful,
Yeah, well, pretty stressful.
education wise, it was being education on the floor. Because let me tell y'all something. I want you, if you're working in healthcare, to go hug your nursing educator immediately the next time you work. Because we get so much stuff thrown our way. Being a bedside nursing educator, they expect us to work on the unit. They expect us to attend meetings that they don't even give us information about. And then we show up and we're supposed to have answers to their questions. They expect that we're going to be able to educate all of the nurses on the floor, in addition to attending all of these meetings and making sure that we're meeting standards and guidelines for the hospital and helping the hospital have money. Nursing education on the floor is treated as a unilateral position change, meaning that it's not a promotion. They don't treat it as a promotion. They treat you as like, I don't even know how to explain it because it's so bad. It's just like they have unrealistic expectations of you as a clinical educator on the unit. That's what I'll say. So that was probably, honestly, out of all the careers I've done, that's been the most stressful one, just because of the way that they treat you. But unit wise, I think the most stressful unit that I worked on was the ER, especially level one trauma, because you constantly have patients that are moving. They're either going to the floor, you're getting a new patient in the room, you're just like starting all over again constantly with new patients, fixing them, sending them off, fixing them, sending them off. If you work in a trauma center, you've got like really bad patient scenarios where they're either fallen from someplace and they're bleeding from every place and they've got broken bones. Like if you're an adrenaline junkie, that's fantastic, but you still have the other, like, 4 patient rooms, 5, 6 patient rooms that you're taking care of in addition to that. So I think ER was the most stressful for me, bedside-wise. I haven't had a least stressful bedside experience.
Yeah. So someone just got accepted in a nurse residency program. Advice for new grad
In regards to what?
when they just got into the nursing residency program, like what they need to look for, like.
So somebody just got accepted into the RN residency program, advice for a new grad. Um What I will say is enjoy the calm before the chaos, meaning that you're probably gonna have a whole bunch of classes and things before you actually go to the unit and start on the unit. So enjoy that little period of time where you're not like actually on the bedside learning how to take care of a full patient assignment. Enjoy that, and then when you actually get to the bedside, like I was saying before with the high school student, be curious, right? Be curious, ask your questions. Um, if you don't understand something, tell your preceptor that you don't understand it. Like, be very vocal about like what's going on and how you're feeling. Because if you can build a really good rapport and relationship with your preceptor, that'll carry you as you go through the remainder of like your RN experience, becoming like an RN from a graduate nurse. Um, Always show up on time. If you have to show up a little bit, or here's the deal. Here's a good piece of advice. In the beginning, when you are trying to learn how to take care of your patients, sometimes it's best that you show up a little bit early before you actually clock in for your shift to just do like a little quick review of what your patient assignment is, who you're seeing, and like what kind of day you're going to have. Because what I will tell you is that based on experience from graduate nurses that are coming through now that are taking RN residency programs, there's, like, this thing, and I get it, I completely get it, where it's like, I'm not showing up until I'm gonna get paid to show up, and I'm not doing anything outside of that. And I understand that aspect of it, but you don't have a whole lot of time when you start your shift to look up your patient information. And when you're first starting as a graduate nurse, that's really hard for you to grasp or be able to research or figure out what your patients are in the beginning. So that's why I say this doesn't last forever. You don't have to show up early before your shift forever, but I would say show up a little early as you're getting started to learn your patient scenarios and learn the situations. That way you're going to be prepared for success as you go throughout the day. Because I'm telling you, especially day shift, you're hitting the ground running. You're going and doing your assessments, you're getting your patient medication, you're making sure they're good, making sure they're going for their procedures or getting the stuff that they need, TPN, like who knows, like just a bunch of different things. But you're constantly moving in the beginning of your shift, and that's where things get missed. So I understand not wanting to come to work because you're not getting paid for it, and that's why you don't want to show up early. But I think that it would be wise if you showed up a little early just to do a little quick review. You don't have to do like a major review, but at least have like a little bit of an idea.
um, Advice for a 19-year-old nurse re-entering workforce. 19-year experienced nurse re-entering workforce. Like giving
Oh,
out,
she had been a nurse for 19 years.
but
Oh, I thought you
no,
meant she was
no,
19.
no,
I
no.
was like, I don't know how to answer that. So advice for somebody who's been a nurse for 19 years and re-entering the workforce.
Yeah.
I got it. I got it. Sorry, I was a little confused. I was like, I don't know. I don't know. Um, so I had the privilege of working with somebody who was phenomenal. She actually created a program. It was called the Transition to Practice program. It was for nurses who had been away from the bedside for a period of time and then decide to come back to the workforce. If the hospital you are going to has a program like that, then you're going to be set because that's the whole thing that they do is they help you transition back into the healthcare environment. If they don't have that, which a lot of hospitals don't, but if they do have that, what I will say is that in the beginning, it's gonna be a little bit difficult. You know it's gonna be difficult because you've been away for so long, and there's been a lot of things that have changed in the last 20 years when it comes to healthcare. I mean, think about it. COVID alone, which happened in 2020, it feels like a lifetime ago, but y'all, it was only 5 years ago. There's been so much that's changed in that 5 years. It's crazy how much has changed. So, know that there's gonna be things that you don't know. Know that there's gonna be a lot of things that you do know because you've had the experience for a long time coming into this, and that certain things over time as you're going through orientation, you're gonna pick back up again. It's almost like when you haven't talked to a friend for a long period of time, and then all of a sudden, like, you have that conversation with them again, and it's like you picked up where you left off. That's kinda like what healthcare is, right? You might have to have a little bit more of a conversation to figure out, like, what happened in the last 20 years, but you will absolutely 100% get there, and it'll start to come back to you, and it'll become like second nature again. So give yourself some grace. Know that there's gonna be things that you may or may not know, but know that, over time, you're gonna build up that skill set again, and you're gonna be just fine. You're bringing a lot of experience that a lot of people don't have, so you're already light years ahead. Trust me. Trust and believe that.
Let me see. Let me see. Let me see. Do you remember your first patient case? How did you feel? What's your advice?
Don't remember my first patient case?
Yeah, like your like serious. I mean, like serious patient or your first patient like on your own back then. And
I
what's your advice and what's your yeah.
I've had so many patient experiences, y'all. I could literally do a story time. I had a patient fire me. Well, technically the wife fired me because the patient took a picture of my butt when I was turned around and she found it in the phone and she fired me. And that was when I was a brand new baby nurse. And I literally cried in the bathroom for like an hour. And my preceptor found me and she's like, "What's wrong?" And I was like, "My patient fired me." And then I ended up finding out the reason why. And it was just like crazy. It was just crazy. I was just like, "This is ridiculous." Now I'm like, "Please fire me. Please. Please fire me." I had that happen to me. I had I remember my first patient's death. I think you'll always remember like the first time that you have a patient that passes away. I had a patient that I was taking care of. He was very very kind man. He just all of a sudden went into cardiac arrest. He actually had a pulmonary embolism. He was on blood thinners. Like we knew that he was at an increased risk for it, but like he was doing really well. And was following all the guidelines and things that he was supposed to for uh being bedbound in that moment after surgery and things like that. But he ended up throwing like a massive PE, and because it was just so like there was nothing we could do. You remember those situations. You always remember like children. I've had children that come in that were SA'd by their uncle working in the ER. That was like absolutely devastating to me. Like even like having a conversation with a child that like doesn't even understand what happened, but they're just telling you like cuz children are so innocent, they're just going to tell you. You know what I'm saying? They're just like, "Well, this is what happened." And you're just like disbelief. I'm like I remember things like that working in the ER. I remembered like my oncology patients. I had worked with an educator when I was actually an administrative assistant. She ended up getting leukemia out of nowhere and she ended up like dying and I was devastated. I was just like, "What happened?" Like she just like it got so bad. Like her numbers were just so low.
Oh, I remember
You
that.
remember that? Like
Yeah,
she
it was
just
like within a week.
it was crazy. Like she just died. And then I had another situation, my the person that made me want to be an ER nurse. Like her name was Susie Miller. I'm never gonna forget her. She's the reason that I became an ER nurse. Her and Vicky Stevens. They were fantastic, both of them. But I came to work one day and Susie passed away. And I was like, what? Like that was devastating to me. Like you remember certain things. You're gonna remember certain things. Like people are gonna make or break you in this career. You just have to kind of like have empathy, but keep moving forward, keep pushing forward, unfortunately, and separate, your professional and your personal life. But you're gonna experience some things that are difficult. Like nursing is not for the weak. Healthcare in general is not for the weak, if we're just being honest. Um, but yeah. Damn, now I'm sad. Do you get into argument with doctors all the time? It's my favorite. If arguing with doctors was an Olympic sport, I would excel at it. You know why? It's because doctors, not all of them. I've worked with some amazing doctors. Especially working in critical care, like our pulmonology intensivist groups are always like incredible, incredible doctors. But I've worked with some doctors, s- most of the times it's surgeons, if I'm being fully transparent, that like to yell at graduate nurses and it drives me insane. And I have to basically like have to pull them in a corner and be like, "You remember when you were a resident, back in July of so many years? Because I've been a nurse for a little bit. You remember when you were a resident and you try to give my patient 10 milligrams of morphine in one dose? Do you remember that? People make mistakes. Stop yelling at my nurses. Like I get into argument with doctors all the time. Man, I wish I had an Olympic sport because I would be so good at it. So good at it.
Any tips for new grad to do well, managing time and avoid mistake while learning your specialty?
You're gonna have to ask the question again. I was still talking about the
Oh,
doctor
sorry.
thing.
Any tips for new grad to do well, managing time and avoiding mistake while learning your specialty?
Any tips for new grads to do well? Why? What?
Managing
Managing
time,
time
yeah, and avoiding
and
mistake.
avoiding mistakes. Here's the deal. You're not going to avoid mistakes. As humans, we are human, right? So we're going to make mistakes. As long as you don't harm anybody and you learn from those mistakes, you're going to be fine. But trust and believe that you're going to make mistakes and you're probably going to have a difficult conversation with somebody at some point in your career because of the mistake. But as long as you're willing to learn from the mistake, you're going to be fine. When it comes to time management, that is the most difficult thing, right? Especially with being a nurse. Time management is so hard because you could have your entire day set up and one thing happens that completely throws a wrench in that day, right? Where you're just like, all right, this is great. My day's going fine. And then all of a sudden they transfer your patient someplace and you end up with a complete train wreck and it just messes up the rest of your day. What I will say is to give yourself grace. Nursing is 24/7. 24/7. 24 hours, 7 days a week, 365 days a year, 366 if we have a leap year. Whatever you can't get done will get done by the next shift. You know what I'm saying? Like there's only so much that you can do. I think that there's like this unrealistic expectation, especially when you have a very heavy patient load or you have a lot of things going on, that they think that you're going to be able to do everything and anything in that period of time, in that 12 hours. Sometimes it just doesn't get done. I can't tell you how many times I worked night shift and I had nurses that would be like, I couldn't hang this magnesium, or, oh, I forgot to give this patient their Tylenol. Can you give it to them? Of course. Nursing is 24/7, right? Like there's just so much that you can do at the end of the day. It is what it is. Congrats, Juliet, on passing your T's. What state am I in and how much is the pay? Well, this is what I'll tell you. I'm not telling you how much I get paid. But as a graduate nurse in the state of Florida, depends on the specialty. So we see anywhere from like, I'm going to say the very lowest being like 20, 25, 26, all the way up to like 33, 34, 35, depending on the specialty that they're in.
Oh, that was good.
What?
How can you improve doing first round clinicals?
When you say first round clinicals, do you mean like what do you mean by that? Do you mean like when you're doing I can't think of the name of it. When you're doing like rounds with the doctor or with the nurses, or do you mean like you're doing clinicals and fundamentals or med surge? I just need to know like specifically which population I'm speaking to because those are completely different. Huddle. The huddle is the word I'm looking for. Um, Ohio 32 to 37.5. Nice.
So tell them what computer you prefer to use for school.
What computer do I prefer to use for school? Whatever one you have. Here's the deal, y'all. Your computer for nursing school doesn't have to be fancy, right? It doesn't have to be anything crazy. It just needs to have like enough memory and enough RAM and the ability for you to use like your Microsoft Offices and suites and all of those things and be able to access your Blackboard or whatever. They have different names, Canvas, whatever it is. They've got different names. You just have to be able to get those things. So if you've got a computer that works, fantastic. If you're looking for to get a computer, just get a cheap one. Get a cheap one that'll still get you what you need at the end of the day because you don't need anything fancy. When you become a nurse and you start making bank, then you can get a better computer.
Unless like they've got those AI sim that might need a little bit more. Remember, some online colleges give them a
But don't they
meta.
give them a computer?
No, just a yeah.
Talk to your college about it. I didn't do simulations like with AI when I was in school. Like we touched people.
Yeah, so that those might need a little bit more.
So I don't know. But get whatever works for you. Like it doesn't have to be anything crazy. I want to be an LVN before RN bridge first steps. Uh, just the same thing like with RN, right? You take your T's or whatever, Hesse, Kaplan, whatever it is that they want you to work at. And then you just go to, you go to your LPN, LVN school, you get a little bit of career access under your belt. And then you can move on to RN a little bit later. I mean, there's nothing wrong with that career pathway. If that's what you want to do, if you want to do LPN first and then eventually go back to school to do RN because you want to start working a little bit sooner, you can do that. But it's the same whether you do RN or LVN. It's just it looks the same pretty much.
So what is the advice for someone who eventually want to be an OR nurse, starting RN school in January and want to do like the right steps?
So this is what I'll tell you for those of you who want to get into the operating room. There's no like good pathway to get into the operating room because the operating room is its own thing. Here's the careers that I'll tell you. Just specifically adult world. I'm not talking about child world. I'm talking about adult world. If you're wanting to do ER, bedside like ICU or OR, there's nothing that's going to really prepare you for any of those areas. You just have to get into those areas. If you were trying to find like a unit that maybe will get you to speak with the surgeons, to speak with the OR staff a little bit more or get to know them, then I would say work in some kind of surgical unit. There could be like a surgical ICU, surgical PCU, um, something surgical if that's what you're ultimately wanting to do is to do OR. But I will tell you is that as you're working in those surgical bedside units, surgical PCU, ICU, you still won't be ready for OR because OR is literally so different. Just like the ER is so different from bedside, right? It's the same thing. So if you were looking for like a stepping stone or at least to get to know who the surgeons are and who the staff is in the ORs, to increase your chances of getting a job there in the future, then I would say look at a surgical unit. And I just want to state for the record because Mr. Chung's over there telling people that I'm mean. I am not mean. I had somebody come in here last week and they were basically like, I know somebody who worked with you and they said you were mean. And we ended up finding out that they were a troll.
Maybe that's
Um,
me.
and maybe it was you. I don't know, but I am not a mean person. I listen, I have been so bullied in high school and nursing school and even like becoming a nurse. I was bullied. And I'm bullied a lot because I have a even now, because I have, TikTok and I have all these other things, like, I get bullied for it. They're just like, "Oh, you think you're so cool because you educate online." Yeah, because that's what I like to do. It's just
A
out of everybody, I'm
huge
the night
personality.
and I have a big personality, like, I'm very vocal. If you haven't been able to figure it out until now, I'm a extremely vocal person. So, I get bullied a lot. I mean, it is what it is, but it's okay because, like, I like what I do. I like what I do, but out of everybody, I'm, like, the least mean person. Even with all that bullying and everything, like, I'm still very, very nice until you cross me. Once you cross me, we no longer have a relationship. Benefits of MSN or versus BSN depends on what you wanna get your MSN in, right? Because if you wanna do, like, nursing education, there's not, like, a huge benefit of having it. I got it just because I knew that that's what I wanted to do, and I just wanted to have the advanced degree for it. But if you wanna do, like, nurse practitioner, you wanna do CRNA, then you have to get those more advanced MSN DNP degrees, right? In order to do those things. So, really, the benefit between the 2 is, like, if you want to advance your career. If you wanna get more money, then I would say, like, CRNA is going to be your route. NPs don't make a whole lot initially, uh, especially if you have to work under the supervision of a, provider like an MD or a DO. Sometimes you don't get paid a whole lot transitioning, maybe it's just a little bit more. Sometimes you get bonuses or things like that, but a lot of people, at least the people I've spoken to, like, aren't jumping into the NP route, they're usually jumping into the CRNA route because of the difference in the monetary value.
What do you think about pediatric nurse practitioner versus pediatrician?
I think they're both good careers. If you wanna be a pediatric nurse practitioner, that's great. If you wanna be a pediatrician, I think that's really good too. I think both roles do a really, amazing job in regards to taking care of our pediatric population. It's just that they look a little bit different, right? Depending on the state that you're in, nurse practitioners will have to work under the direct supervision of a medical provider. So there's certain things that you can or can't do. You can't work autonomously, depending on certain states. Not every state, but just certain states. But with a pediatrician, you have like a lot more autonomy. You have a lot more flexibility in regards to your career. But there's nothing wrong with either one. It's just that when you think about the education piece, that's where it comes into play. Because if you think about it, to be a pediatric nurse practitioner, you've got at least 4 years of undergrad and then another, like, 2 years-ish or more. Because if you get a DNP, it might be another 2 to 4 years as a MSN or DNP student. Whereas with a pediatrician, you've got several years of medical school, then you graduate, then you have residency. Residency could be, like, 4 years, because you got R1, R2, R3, R4. And then you might do fellowships. So some people might do a fellowship after that, and that might be more years. So if you're wanting like a lesser education, like pediatric nurse practitioner might be the route. If you're good with having like the incredible amount of education you get with being a pediatrician and you've got that time frame, then do pediatrician. Nothing wrong with either one though.
What's the best path to nursing informatics from your experience?
Best path for nursing informatics.
Yeah.
I don't think that there's a best path per se. There is a degree that you can get in nursing informatics, a master's degree, but you don't necessarily need it in order to work in nursing informatics. My thing is, this is what I'll say: work as a nurse for a couple years, like 1 or 2 years, and then apply for a nursing informatics job. Particularly on the computer system that you know, right? So if you work in a healthcare organization that uses Cerner, or they use Epic, or they use something else, right? Work in another organization or the same organization that uses that same computer system because you already have a really good idea about it. Try to be like the go-to person on charting and things like that. I think like when you do your interview and you talk about that, I think that's gonna like really help you with your interview and getting that position.
So there's one. Which is the answer to. Oh, does ADNS learn everything BSN learn?
Does the ADN learn everything that BSN learns?
Yeah.
So here's what I'll tell you. So ADN is where you really learn everything. Because your associate's degree is like the meat and potatoes of becoming a nurse, right? So that associate's degree is I mean, just like all of your clinicals, like all of that, your testing, the disease processes, things like that. If you're doing a traditional BSN program, not the RN to BSN, just the BSN program, you will learn the exact same things. It's just you have a longer period of time to learn them. So typically, an associate's degree is 2 years, your bachelor's degree is 4 years if you're going the traditional route. Now, if you're wanting to do the associate route and then do your BSN online later after you become an RN, you're not really learning a whole lot there. You're learning like how to write papers, how to do research, learning a lot about like ethics, integrity, things like that. Uh, but I wouldn't say that you're necessarily like you're not getting like a whole lot of hands-on or anything like that. It's just a lot of paper writing. At least my BSN was. So traditional BSN and associates, you will learn the same things, just at a little bit of a different time frame. And then RN to BSN program later, you won't learn a whole lot in your BSN.
What's the advice when taking accelerated AMP one and two?
Oh, accelerated A&P 1 and 2? They
Mm-hmm.
have that?
I guess like in a summer class, then you're much
Oh, in the
shorter.
summer classes, that would make sense.
I mean, there it is. I mean,
All I can say is best of luck. Listen, accelerated A and P, I don't recommend doing accelerated A and P. The reason why is because it's very difficult for you to really grasp concepts in a really shortened amount of time. A and P is just like one of those topics that's like so important when you're going through any kind of healthcare program that doing it in an accelerated way, like taking it over summer or like taking it as like a half semester, where you do like semester A versus semester B. I don't know, every school calls it something different. Um, it's just you're just doing too much too fast. And at that point, you're just trying to memorize and memory dump when you're taking those tests, but you're not actually gaining understanding of concepts. So I'm not a huge fan of any kind of accelerated A and P program.
she's taking accelerated AMP one, and the professor didn't teach a thing.
Yeah, case in point. So, so the was this the person that asked that question?
I think so.
Oh, so they said, no, I'm an accelerated A and P 1, and the professor doesn't teach anything. That's the point that I'm trying to make, is that it's so fast. You're basically self-learning, or you're not really learning anything. Or 3, the professor's not teaching anything. So that's just like one of those classes, and I'm like, I wouldn't recommend taking it accelerated. That's the only thing. But at this point, you're already doing it, so it's just self-learn.
Videos.
Self-learning videos, yeah.
Videos.
Yeah, and really, really understand
Like I would
concepts.
say, if you're not healthcare, that would be like dream because you just bring them, you get it over with. But when
Yeah.
you need it later on, that's more
That's the problem. Let me tell you what happened. So I did not take an accelerated EMP program, but what I did was I memorized and memory dumped whenever I took my test. I got A's in both my A and P programs, but I didn't really learn anything because I was just like, I just need to memorize this for the test, and then I'll relearn it again later if I have to when I'm going through nursing school. Well, when I went through nursing school, my professors were like, I'm not teaching you these concepts. You already passed the class. You should know. Well, then I was screwed because I was like, I don't know any of this stuff. I didn't learn any of it because I assumed you were going to teach it to me later. You really have to know A&P before you go into nursing school specifically, because a lot of times they won't teach it to you. It's rough. Aw, thanks, Lisa. I love you too.
Oh, should I wait to get into the program at their school or go to a school with a new accreditation this year?
Should I wait to get into the program at my school or go to a school with a new accreditation this year? Oh, so here's the deal. Accreditation typically lasts like a little bit of time. So it's not like 1 year, 2 years. Like usually they've got a period of time, like 5, 10 years, depending on the school, that they remain accredited. My question to you is are they nationally accredited, or are they regionally or state accredited? Because a lot of times with these newly accredited schools, they don't necessarily meet national accreditation. They don't fall under either the ACEN or the CCNE, which are national accreditations for nursing schools. And usually they're a regional or they are a state accreditation. In those situations, you run the risk of them closing down the school because they didn't meet accreditation anymore, or they didn't have like enough people that were going to the school, so they were unable to fund their programs, and now their credits are not transferable to a national accreditation college because they didn't meet the national accreditation standards in the first place. So that's kind of like one of those like you're standing on the ledge looking down type of situations. Like it may be okay, but somebody might come behind you and push you off the ledge, and then you may, like, fall face first into the dirt. So that's just, like make sure you're doing research on that, because that could be a really bad situation, or it could be okay.
So someone anxiety is through the roof. She's taking her fundamental fluid and electrolyte exam tomorrow.
I was there with you, I know what it's like. So somebody's anxiety is through the roof because 'cause they're taking, first of all, fundamentals, that means first semester, right? And it's fluid and electrolytes. There's so many fluid and electrolytes. And they innervate so many things within our body, right? Like sodium and potassium alone does a lot. That's not even talking about like magnesium and chloride and phosphorus and all those other things. So what I will say is deep breaths. When we get really anxious, we start to second guess ourselves and we start to change our answers. What I will tell you is when you're taking your test tomorrow, unless you know with 100% certainty that one answer was more correct over the other, don't change your answers. Because I did that where I was just changing my answers willy nilly because I just was second guessing everything and anything. And I ended up getting some not great test scores because of that. So usually your gut is right. Usually your gut is telling you that something else is right.
Um, High school senior here, thinking about becoming an RN. What should be the best pathway? What would be?
Yeah, so, high school senior trying to become an RN, what's the best pathway? So what I will tell you is my biggest recommendation is finish high school, get your diploma. You can go to a university or you can go to a community college. There's nothing wrong with either one of those things. Don't let anybody tell you that, "Oh, you're in a community college, you couldn't hack it in university." No. You're still gonna get the same education as everybody else. It's just gonna be from a community college versus a university. So, pick whatever works best for you. And then do your prerequisites. Look for schools that you would want to go to as an RN. So look at their programs. What prerequisites do they require? What are the pre-admission testing that they require? All of that stuff. Like get to the nitty-gritty of specifically what it is that they need you to have in order to apply for the program. Take your prerequisites. Once you're getting close to the end of your prereq, start studying for your pre-admission tests. Take your pre-admission tests and apply for your school. I think that's the biggest thing. Don't mess around so much when you're going through your prerequisites because if you get poor grades, that will affect your ability to get into nursing school at the end of the day because they always look for who did well on their pre-admission testing but also did well on their prerequisites because your prerequisites to them speak volumes and how you're going to be successful when you're going through the program. So try to get really good grades, try to get as close to a 4.0 as possible. You can still get in with less than a 4.0, but the higher your grade GPA is, the more likely you'll get into the school. And then really just like start studying for that tease. If you know this is what you want to do, start putting in the time, start getting serious, and start doing it now. Don't take too much time off between high school and college because that's what I did. I took several years off because I wanted to make money because I thought that money was everything and that if as long as I had a job and I was making money, I would be good. And then I eventually went back to school, but it was a while. It was a while after I finished high school. And to be honest with you, I didn't finish high school. I got my GED because I got bullied a lot in high school, and it was becoming to the point that, like, girls would start to wait by my car after school, to beat me up. I didn't even know who half these people were, but they just didn't like me. And just like, I don't know, maybe I dated their boyfriend and they hated me. Who knows? I have no idea. But it's the point that, like, I got my GED and it's okay to go to a community college, go to a university, just get serious on what you want to do and then get it done and get it over with.
That's it.
That's it.
I think we ended pretty well.
Yeah. Yeah, go to community college, you have less debt, right? Universities you pay way more. Depending on the university. All right, y'all. I think that is it for tonight. I didn't realize it's already been 2 hours. That's crazy, right? We've been having so much fun. We will be back next week for another Sunday shift. And for my TikTok folks, we got something special happening on Wednesday. So if you get a little notification that I'm popping up, I will be going live then. So be ready and rearing to go. We're going to kind of do the exact same thing that we were doing today.
But it's TikTok exclusive.
But it's a TikTok exclusive. So unfortunately for my IGYT folks, I won't be live on that platform. This will be exclusively only for my TikTok folks.
And
It's on Wednesday, 8 p.m.
8 p.m. Eastern Standard Time.
Yeah.
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 So just so they know.
So yeah, just be ready. You'll see it. You'll get information. It'll pop up. So super excited about that. We'll be back next week to do another Sunday shift. I think this was great. I think you all had a lot of really good questions. Hopefully I helped lessen some of the anxiety that comes with healthcare, but also give you like a realistic outlook on what's going on in healthcare and what to expect once you get into it. And again, I always recommend become a nurse. You've got so many opportunities ahead of you. You've got so much that you can do in healthcare. This is the career to do. Even if you don't like bedside, there's so many other things that you can do. So yes, 100%. If you want to be a nurse, be a nurse. But I hope that you all have a wonderful evening. For my Tease folks, we'll be back tomorrow, Tuesday and Thursday to go over Tease content. And then Wednesday, a little special one for my TikTok folks. So